as she is lying prone here, I'm trying to discern if there is an asymmetry, and I know the chair's blocking my way, but I'm coming underneath the lip of the trochanter on both sides. And it does look like the right trochanter is more inferior than the left. So it's just a hint that there is potentially some asymmetry and the right trochanter is more prominent. In fact, if I could take the camera to the edge of the table, you would be able to see what they call a gluteal skyline, in which this gluteal mass is more prominent than this one. And as I lay down here, it's not necessarily prominent in this context. I thought that it would be. When I look down on it, it's more prominent. And it seems to be more the upper pelvis. I'm just going to move her into a seated context. So she's going to come sit in the symmetrical chair with feet on the floor, and I'll continue to screen, okay? So can you come sit, please? And again, one of the problems is long-term sitting comfort is an issue. And we need to see what we can do about that. So with Dawn sitting fairly symmetrically in the chair, feel like you're sitting fairly symmetrical?
Yeah.
You're not wonky?
Don't think
Okay. This femur is taller because the tibia apparently is taller. So when you're laying on your back, it's not apparent. When you're standing, it's not apparent. Initially, the pelvis was in fact asymmetrical, and it didn't move well in certain directions. And then that changed, and the pelvis became symmetrical. And I think what's at the heart of that is an asymmetry in which the right tibia is taller. And typically what accompanies that is on the opposite side. Sometimes the femur is longer and then it cancels out. So there really isn't a leg length difference when you check the leg length at the medial part of the ankles. And there's good research to show that that's a fairly reliable way of evaluating it with a tape measure. And noteworthy is that the femur appears longer. Remember I said sometimes it cancels out with the opposite side. I'm going to take that statement back. I'm just going to say that oftentimes if there's an asymmetry in the height, it does also present with an asymmetry in the length. I'm going to look at the pelvis, and the right ASIS appears to be more anterior than the left, and it's not subtle, okay? I'm going to come behind the chair, and I can get my hand rather deep, really free, rather readily on the right side. Do you feel me strike that? Mm-hmm. Okay. So you have easier freeway space on the left. So if I support you here on the left side, what does that feel like?
Comfortable.
Comfortable?
Yeah.
Okay. What happens if I do it here?
Uncomfortable.
Uncomfortable. Yeah, this exaggerates what you present with. So what I'm going to do with you now is I'm going to experiment. What happens if I put a heel lift under this foot in sitting, which we would not use in standing? What happens if I put a wedge under one trochanter, pull it out, test on the other side? What happens if this looks lower, this side is lower? What happens if I put a lift under the left sit bone? And what happens if I support behind the left ilium so that the chair, what we're trying to do is bring the floor and the chair to find your pelvic lower extremity structures where they are, how they present, rather than trying to force them and push them into symmetry. You don't have symmetry. So you're at war with your sitting device. You understand that, even with the floor. So we'll experiment with that, and I think it's a very relevant thing to look at. More and more I see clients who have this kind of an asymmetry and benefit significantly with simple things that can be done, and they can do it at the office and at home and even in the car. And I had one woman that had significant discomfort, and she earned her living doing home health care as a PT in a rural part of Iowa. And I treated her on a Friday, and she had to drive to a wedding that evening and drive back, and that was over 2 hours one way. And she took the seminar the next 2 days and had no pain whatsoever. And we modified every one of those things. We gave her a heel lift in sitting. We put a lift under an ischium. We put a support behind one ilium. And then we did a wedge under one trochanter. And she found that to be very helpful. We have some people in which it makes no difference, and that's fine. But I think it's very worthwhile to evaluate this in this population. I'll stop filming here.